Hi, I'm Colleen.
Hi, I'm Heather Payne.
It's nice to meet you.
Nice to meet you.
So I'm here today because I'm 19 years old. I've never done birth control, and I've heard about the pills, but I also heard about some longer acting methods, and I wanted to talk to you a little bit more about those.
Oh yeah, well, so we recommend a long-acting method really for pretty much everyone. They're more effective than the old methods like the pill and the shot at preventing pregnancy. They have less side effects, really low in side effects, and they're safer because they're progesterone only. They don't have any of the estrogen that the pills have, which was the hormone that we, with some patients, have concern about with increased risk of stroke or blood clots. So the long-acting methods are great. There's three of them. The one is the Nexplanon, and it is insert. It goes under the skin of the arm, and it lasts for 3 years. Then there are two types of IUD. There's a Mirena, and it's the IUDs are inserted in the uterus during a pelvic exam. Have you ever had one of those? So it would be part of that exam. And the Mirena is good for 5 years. It also releases a low dose of progesterone, and then the Paragard is good for 10 years, and it doesn't have any hormone in it at all. So the 3 and 5 year, the Nexplanon and the Mirena IUD, with the progesterone, it's a very low dose, so hardly any hormonal side effects, but the one thing that the progesterone does is it thins the uterine lining. So most people have a change in their menstrual pattern, and they have a lot less bleeding. Some people kind of stop their period altogether, and that's absolutely safe because the uterine lining is not getting thicker, it's thinning out. That gives you some protection later in life against uterine cancer. And people really like the not bleeding. Now, you may still get some spotting with those methods here and there, or light period, but it's usually generally less than what you're getting if you're having a regular monthly period. Some people get into a problem where they're getting spotting on a lot of days, or it's stopping and starting and being annoying, and we can treat that. We can give estrogen or some other treatments for short term to stop any problem bleeding, usually. But that's really the only real side effect we hear. So people really like them. And then with the 10-year IUD, there's no progesterone. It doesn't thin the uterine lining. The period comes at your regular schedule, but it tends to cause, a lot of times will cause the bleeding to be heavier and or crampier. So some people still do that one, but I think the progesterone only ones have been the most popular.
And are those painful to put in?
The Nexplanon's not. We numb that with a little lidocaine, topical numbing medicine, and it doesn't hurt going in at all. It's really quick and easy insertion and removal. The IUDs for someone who's never had a baby, and you haven't had any children, that they tend to cause some cramping at the time of insertion. So we usually have you take ibuprofen before you come. We use warm compresses to try to help some with that, but they can be a little bit uncomfortable. Some discomfort at the time of insertion. And removal's really easy for both of those.
And if I want to get pregnant and I still have them in, I can just get them taken out?
Oh, yeah. We can remove them at any time, either if there's some irregular bleeding that's bothersome and we're not able to knock it out, or if you want to try to get pregnant. And the nice thing also about these new long-acting progesterone-only methods compared to the old birth control methods is there doesn't seem to be much, if any, lag time between removing them and going back to normal ovulation. So you can use them right up until you're ready to have a baby if you want to.
Well, thank you. I think you answered all my questions.
Thank
you.